some exciting news for us. Tell me, I've seen some pictures. Darling, spill the beans.
Yes, so I've just opened my new salon. The name is pronounced Épanouie, and it's French. It means blooming, blossoming, flourishing. So I've been a stylist for about 5 years, and I'm really excited that I opened my own space. I specialize in coloring and updos, styling, so I'm really excited
It's
about
so
it.
cute. And I noticed you got your little pink velvet couch
Yes,
in there.
I found a place for the couch.
I was so excited when I saw that in your pictures.
Yeah, me too. It's very cute. I'm excited.
Congratulations.
Thank you.
Good stuff. And today you're here for some good stuff.
Yes.
We're going to do a little Botox today. I know Sarah's young, but she's all about preventing, and so she's on the track at a young age for healthy skin and preventing some of that stuff that comes with age. And tell us about one of your favorite products too.
So, I mean, you know that I love Latisse. It's my go-to for everything. My sister and I both use it just to enhance our natural lashes, and I get compliments like every day about how long they are, how thick they are, and it's all my natural lashes, so that's like a tried and true. I think ever since I started coming to Timeless, that's what I've done the whole time.
Oh, that's awesome. And for right now, that's what we're all seeing still are those eyes. So it's such a great product to have right now to really emphasize. And they can have great eyes and great hair.
Yes, perfect.
I love it. Well, if you want to pop down right here, Dr. Ola's going to come in and she's just going to kind of quickly obsess. And since we're in a new year, we're kind of like getting everybody kind of reevaluated and getting on a plan for this year. So I'll go grab her. So good to see you and congratulations.
Thank you.
Well, hello, ma'am.
Good morning.
How are you?
Good, how are you?
I'm so excited about the new place.
Me too. Can't wait for you guys to come in.
I know. We'll be in.
Sarah, where are you located?
So I'm at the Salon Lofts in Grandview. There are 2 buildings. There's one that's a newer building that's right under the View on 5th Apartments. So Suite 3 and 4.
Oh, I know where that is.
Yeah. It's a great spot. There's some good like restaurants around there, and
Yeah, that's great.
it's fun.
Are you with somebody else here or just yourself?
It's just myself for right now. So plenty of space for social distancing, and it's just very nice and just calming. So that's the whole point.
All right, ma'am. We're for sure going to do around your eyes today.
Yes.
Correct?
Yeah. Definitely jaw.
You wouldn't do masters too?
Yes.
Okay, perfect. We've also done, for Sarah, we've done, so what we're talking about with Sarah is we kind of talk through her dosing at every visit, because that's important. There's lots of different ways to do Botox and dose Botox. For Sarah, we like to do a little around her eyes to kind of open up her eyes. Just provide an overall opening, a slight lifting, raising of her eyebrows that she loves. We also, you can go take your mask off for me. We also do Sarah's masseter muscles. These are the muscles that we chew with, but we also clench our teeth with. Sarah's a clencher, as many of us are at night. It's bad.
Yeah.
So we will inject some Botox in here, which relaxes those muscles. She still will chew. She won't be able to clench at night, just relieving some stress. And that really makes a big difference for Sarah. We've also done a lip flip. Are we doing that this time?
We can do that this time.
Okay,
Yeah.
so what that does is just pulls up the lip. We just inject a little Botox right in the midline, and it pulls up those lips. Just kind of increases the pout look. It isn't like getting lip filler, but it is kind of dipping your toe into that lip world. And Sarah's done this before and loves the look. Just a little bit of increases the
It's like
pout.
very natural.
Yes, yeah. So we will do that as well. We're excited.
I wanted to ask you too.
Yes.
Just these little guys up here we had done before,
Yeah.
and I didn't know if you felt like
Raise up
needed a
for
little
me.
touch up.
And relax. Yeah, I think we should continue that dosing that we did before up there.
Yeah.
The reason is if we kind of back off that and you're raising up those eyebrows, those fine lines can kind of come back, so to speak. So we want to make sure we stay on a good dosing schedule with those so that those relax and those aren't visible at all. Okay? Go ahead and lie back. I am just going to mix up a fresh new batch of Botox for you.
So excited.
So when did you officially open?
This week was my first week, so Monday was the first day. And it's going really well so far. I'm really excited.
And were there limitations with you talking to clients or?
No, I mean, you know, I always want to be respectful of, you know, like square one and everything, but they were super supportive and, you know, I was there for 5 years, so we have such a good relationship that I tried to kind of wait, but I have a really good personal relationship with a lot of my clients, so I tried to just kind of navigate that the best way that I could. But pretty much with social media, it's so easy to get in touch with people right now, so it makes it easier.
Well, that is exciting.
Sarah, what's the hottest hair trend for 21?
Oh gosh, you know, it's like constantly evolving, but I feel like right now the like 90s trends are really popular. So like the supermodel blowout big curls are really popular, and then you have like curtain bangs, which are more like droopy bangs. I've done a couple of those this week, so
We're shaking our head no.
Unless it isn't true, Sarah.
Dr. Olah and I are, yeah.
it's coming back,
We
you
lived
guys.
that.
Yeah, we
I'll
did.
tell you.
We lived that.
It's all coming back. Really, I feel like everyone is just wants to have like healthy, you know, like pretty hair right now. So because we're all home and we're not styling it as much, it's all about like getting it super healthy. Even if that still means coloring, just doing that in a way that maintains the integrity of the hair is what a lot of people are really concerned about right now.
So do you see trends long or short hair?
Both, honestly. I mean, you kind of have like different trends for each length, which is nice. So I feel like it's a little bit more of like a texturized cut right now that's coming into style. I would say last year and the year before it was like super blunt, like shorter cuts that were really structured, and now we're kind of moving to like some softer shapes. So, but there are always shorter trends and longer trends.
It seems in the demographic, say 45 on up, what are you seeing?
Honestly, it's all very similar. So keeping it really soft. I mean, everybody wants to feel like youthful. So sometimes the structured cuts like can age you a little bit more. So just really soft colors. Everything is really natural. Still doing some layers, but nothing that's like super structured. So even if you get volume, it's very like billowy, instead of having that like set in like hairsprayed, you know, super
Pageantry.
Yeah.
Right. Okay. All right. And then what about color for the age demographic of 40 on up?
You know, I always try and talk about with like each individual client how they feel comfortable. So even because your natural color is changing so much, like where do you feel the most comfortable, and then just kind of enhancing that. So I love going off of like a natural base, whether that's like a little bit of a darker base with some pretty highlights, or just adding in some like warmer kind of like iridescent tones. I feel like it just kind of like brightens up your face a little bit. So I try and keep it super natural, nothing super harsh. But just kind of enhances like your natural beauty. So depending on like your eye color, your skin tone, it's kind of all customizable for everybody.
That's great.
Yeah, it's fun.
If you could pick a celebrity that you love their hair, who do you follow and why?
Oh my gosh, there are so many. My friends know this about me. Right now, I feel like I'm loving Dakota Johnson. I mean, I love her anyway, but her hair is like my hair goals right now. It's so pretty. There are so many celebrities that I like love that I follow for hair inspiration, but I'm trying to get mine to grow pretty long right now, so she's my inspo.
Okay, so we're going to move over and just say hi to Dr. O. Dr. O, how's your year starting so far?
It's great. We're excited here at Timeless for the new year, new you, new assessment of everybody, and making sure we're on a good plan for each patient individually, and that we're happy with how we're trending, how we're moving forward with our skincare goals. It's been great.
Tell us a little bit about the skin script and why it's so important to follow that.
So with each patient, we do what's called a skin script. So not only your plan with us for procedures, but also your plan for your overall skincare. Your the daily products that we would recommend, from cleanser to sunscreen and everything in between. We talk about spot treatments if needed. We talk about, again, that all important sunscreen and what's needed. And we go through each product and explain the why of each product, explain the how of each product, how to layer them, and really, most importantly, what is the goal of each product? What is the role of each product? So you understand as you're putting that product on, what are we trying to achieve with that product? Ready, Sarah? Okay, go ahead and make a frown face for me and then relax. So just a little bit right here, so we raise that midline of the eyebrow. And we're just going to do a little bit on her forehead. Raise up for me, Sarah, and then relax. Placing these units quite high on her forehead. Just to focus where she has some of those fine lines, so that we keep all of those at bay. And then for Sarah next, we're going to focus around her eyes. And again, opening up her eyes. So Sarah, raise your eyebrows for me and then relax. So a little bit of a lift around the eyes. And then again, we want to open up Sarah's overall opening of her eyes. Sarah, go ahead and look to the back wall for me. Ready?
Not even a flinch.
It's more the light that bothers me.
Yes, yeah. She always says that. And this can sometimes make your eyes water just a little bit.
Mm-hmm.
So go ahead and raise up, Sarah, and then relax. So again, raising her eyebrows. Sarah is special in that she has, her eyebrows are ever so asymmetrical, so we fix that as we're raising her eyebrows. And then smile for me, Sarah, and then relax. So again, here we're just kind of opening up her, look towards that back wall for me. Opening up her eyebrows, just opening up the opening of her eyes just a little bit. And she has some fine lines under her eyes that we just work on as well. Next for Sarah, because she's laying down, we're just going to go ahead and do that lip fill. So make kind of a pouty face, Sarah, and then relax. Yeah, you're good. And then this one goes in the midline. It does pinch just a little bit right in the midline. Botox takes effect in about 7 to 10 days. So Sarah will not notice anything today. We will remind her. I'm just going to set you up, Sarah, to do those masseter muscles. We will remind her just to make some faces, meaning raise her eyebrows up, squint her, make her frown face for the next hour. We'll remind her not to wear a hat for the next hour, and to not lie flat or exercise for the next 4 hours.
Love the not exercise.
Should you be hydrating or doing anything else post Botox? Is there any?
No, just moving those muscles to get the Botox into the muscle. So So this one is a little different, not one that everybody's used to seeing. Go ahead and clench your muscles for me, Sarah. And relax. And then clench again. So that is a bigger muscle. That was more injections than you've seen me do, but that's just because it's a larger facial muscle.
It makes such a difference.
Yeah, it's been very life-changing for Sarah. Most of our patients call it that when we do this muscle. They call it life-changing because it does. They don't clench their teeth at night, and therefore they don't get tension headaches midday the next day. They just are able to relax. Okay, so go ahead and clench again, and then relax. Clench one more time. And this is a muscle that we kind of go through and figure out your dosing, which we've already done with Sarah. We know we're at the perfect dose that allows her to chew steak if she would like, but also be able to relax those muscles overnight so that we don't have any issues. After every Botox treatment, we put on HA5, and this allows, just really as it's a product that works in conjunction with Botox. It's a great hydrating product, fills in fine lines, pore size. This helps the makeup stick better. It's just such a lovely product. So that goes on really after every one of our procedures, but certainly after Botox. And that is a product Sarah loves.
It's so good.
Yeah. By far my favorite product. Dee teases me, it's my favorite product. But for sure it's a product that Sarah uses as well.
Fell in love after microneedling.
Yeah.
So, Dr. Olah, talk to us about Sarah's skin script. What else is on the horizon, or what else does she prescribe to keep up with her beautiful skin?
So for Sarah, in her age, and she has a little more, she has some acne, rare acne issues. So we talk about an exfoliating cleanser, an AHA BHA Skin Medica product exfoliating cleanser. We've talked about a spot treatment if she does have those acne lesions that come up, called Indie Lee, which is a lovely, it's everybody's favorite product, another favorite product of ours. We have talked about kind of the in-between. After we cleanse, we've talked about Lumavive, which is a Skin Medica product, AM and PM. That helps with, it has some vitamin C-like products in it, as well as it helps protect against blue light for those of us that are in front of a computer screen quite a bit throughout the day. Works on evening the tone of the skin and overall moisturizing the skin. And that's an AM and a PM. We talk about with everybody a retinol or tretinoin. Right, so we talk about that. We hear about it a lot with acne, but it's great, not for Sarah, because Sarah's nice and young, but an anti-aging product. As in a retinol is a great anti-aging product, as well as works with acne. And then the Lumavive PM, the HA5 is a hydrator for the skin morning and night. And then of course the sunscreen. For Sarah's age range, we'll talk about Elta MD. The Color Science brush, that's just a powder brush that we use throughout the day. Or Total Defense Repair is always a great sunscreen. It's a Skin Medica product because it blocks the important UVA rays, but also those infrared rays, those sun rays, that heat rays that come up while we're standing like on blacktop. So all great products. Again, all things that we talk you through in our skin script as we're talking about the why, the how of all those skincare products. So we know products are important because you can treat your skin daily. As well as there's lots of studies that show patients, when they do use those products, they obviously are even more excited about any procedures that we do. Anything that we do, it's kind of a joint effort because you're using those products daily.
Yeah. become addicted to my procedure.
And so
It's all in a good way, Sarah.
in between Botox is microneedling then?
Yes, for Sarah, we've done microneedling. She's done microneedling just to help with texture of the skin, as well as Secret RF, which is our microneedling with heat through it, which really provides a great lifting, but a great result as far as texture in the skin. That's one of everybody's favorite procedures because, again, we see a lift as well as a smoothing of the skin. Great anti-aging as well as anybody with acne scarring. Yeah, so it's microneedling with heat. The RF is radio frequency energy for heat.
And we do chemical peels.
Chemical peels. Sarah loves a good chemical peel if her work allows it and time allows it.
Yeah.
Chemical peels are great. You just, of course, have to be able to have a little bit of downtime.
It's very worth it though.
Yes, it is. Yes, one of my favorites as well.
Okay.
So that's it. I think we're done for today, right?